From candy corn to caramel apples, October is a spooky season for your teeth. And when it comes to dental procedures, sometimes the words root canal can evoke a little bit of fear.
Yeah, joining us today to separate fact from fiction and to show us why saving your natural smile isn't scary at all is Dr. Stephen Katz, president of the American Association of Endodontists. Thank you so much for being with us today.
Good morning.
Good morning.
And thank you for having me.
Yes.
Let's talk about the importance of saving and preserving your natural teeth, why that is so important.
Your teeth are meant to last a lifetime.
Right.
Unfortunately, we're not like sharks, right? So they don't they're not replaced readily. It's really crucial to save your natural teeth. There's nothing that really functions quite the same, not bridges, not implants. Your natural teeth are important for chewing, for speaking, and for a confident smile. So when we could save our natural teeth, it's really the best option. If you're having pain, swelling, hot or cold sensitivity, that's really the time to visit your endodontist.
Yeah, for folks who have not been to an endodontist, what exactly is that?
Right. So we are the specialists in saving teeth.
Okay.
So an endodontist is a dentist. We have 2 to 3 years of additional training, and we focus on diseases of the inside of the tooth.
Okay.
So the pulp and the root canals. So that makes us the root canal specialists. We use specialized techniques, technologies, and we do what we can to save natural teeth.
Some people worry that a root canal can be painful. What do you tell them to alleviate these fears?
That's really the biggest myth out there. Root canals are no more uncomfortable than having a routine filling done. We have new technologies, new techniques, new anesthetics. We use specialized imaging and precision instruments. A root canal is pain-free and it's quick. So often we hear from our patients that, oh, I can't believe how easy that was.
Yeah.
We like to say this is not your grandmother's root canal.
Yeah, because that used to evoke, as we mentioned earlier, a lot of fear in people. Some people think it's just easier to pull the tooth, but you don't want to do that, correct?
No, it might be easier in the short run,
Yeah.
but in the long run, it's not easier. Again, you know, nothing really looks, functions, or feels like a natural tooth, not implants, not bridges. If you could save your teeth, that's really the best option. And the other thing is that we now know that if you can hold on to your teeth as we age, it's better for our overall health. So less risk of cardiovascular disease, less risk of diabetes, and it improves cognitive function. So really, holding on to your teeth improves your quality of life.
Yeah. A lot of people put off dental care.
Yes.
Talk about why they shouldn't do that.
Right. So, first of all, no dental pain is normal. Okay? If you have dental pain, go to the dentist, go to the endodontist. It doesn't go away by itself.
Right.
And typically it's going to get worse. The sooner that we could see the patient, the easier it is for the patient, the more predictable, the better the long-term success. So if you're having discomfort, visit your endodontist. It'll be pain-free, it'll be quick, it'll be easy.
I mean, we have a bucket of candy up here on there because it's not bad. It's not a bad food. There are no bad foods, but there are some steps you can take to make sure that Halloween doesn't send your mouth south.
Of course. So I think it's important that we don't restrict particularly our children, right? Because then they want it.
Right.
So in moderation, everything. If you're going to eat candy, brush your teeth afterwards, rinse with water, and just make sure that you take care of your teeth. And if you have pain, that's the time to see the endodontist.
Are there any candies that you should be careful with, like the sticky ones? Is that a myth that they'll pull out the fillings? Or
No.
Okay.
Oh.
Yeah, so some candies are worse. My favorite candy is Bitto Honey.
Yeah.
It's probably at the top of the list,
Yeah.
right?
Yes.
But again, in moderation and just take care and clean your teeth afterwards.
People don't normally associate having a root canal with kids. Can it happen in kids?
Well, if in young kids, we typically don't do a traditional root canal in baby teeth.
Okay.
But once you have your permanent teeth, absolutely. And the endodontist has specialized techniques and materials for these procedures. So it may even be more important if you have a youngster
Yeah.
that needs a root canal to see a specialist.
Yeah. Brush and floss, right? Flossing is as important every day.
Absolutely. Brush and floss. You want to brush a couple of times a day, floss at least once a day. Get into a routine.
Yeah.
That's the most important thing.
And don't put it off because, as you mentioned, if it's painful now, it's only going to get worse, correct?
It's only going to get worse. Teeth don't fix themselves.
We wish they did, but they don't.
Exactly right. Oh, Dr. Stephen, thank you so much for joining us. Find out more about the American Association of Endodontists by visiting their website at findmyendodontist.com or follow them on social media. Their handles are right there on your screen.